Thank you. Good evening, everyone. Welcome to this meeting of the Safer Neighbourhoods and Active Community Scrutiny Board, which is being live streamed this evening on the Council's website. My name's Councillor Paul Moore. I'm Councillor for Hatley Heath, and I'm the chair of this board for the current municipal year. Could I ask all attendees to mute their microphones unless they've been invited to speak? During the course of the meeting, if anyone does wish to speak, please use the raise the hand feature, or if you can send a message using the chat feature, and then I'll invite you in turn to turn on your microphone at the appropriate point. Again, when you finish speaking, if you could just please remember to turn off your microphone to avoid any disruption to the meeting. First of all, I'm going to ask members of the committee just to introduce themselves. Can we start with Councillor Boston first, please?
Good evening, Chair. Councillor Ahmed Boston, Councillor for the Abbey Ward and member of this committee.
Councillor Bauer.
Good evening, everybody. Councillor Bauer for St. Paul.
And Councillor Edwards.
Evening, Chair. John Edwards, Great Graded Link Ward in West Bromwich.
Councillor Gill.
Good evening, Councillor Gill, Councillor for Smethwick Ward.
Councillor Sandars.
Good evening, Councillor Sandars here, Councillor for Hatley Heath Ward. A very good evening to all of you around.
Councillor Akhtar.
Good evening, Councillor for St Paul's Ward, member of this committee.
And Councillor Jones.
Good evening, everybody. Councillor Steve Jones from Prince's End.
And if we could just have introductions from the officers who are joining this evening. Alan.
Alan Caddick, Director of Housing and Communities.
Alex.
Alex Goddard, Democratic Services Officer.
Gabrielle.
Gabrielle Evans, Democratic Services Officer.
Nikki.
Nikki Denstone, Service Manager for Business Excellence in Neighbourhoods.
Stephanie. And last but no least, Steve.
Steve Greenhouse, Service Manager for Asset Management and Maintenance.
Thank you very much and welcome all. Can I ask, have I missed anybody there? No? Can I first of all ask whether there are any apologies for absence, Alex?
We've received apologies from Councillor Pam Hughes and Mr Cash, Chair.
Okay. Thank you. If we can turn to the minutes for the previous meeting held on the 17th of December. First of all, can I ask whether there are any issues or matters arising in terms of accuracy or matters from the previous meeting? If not, I'll move those as a correct record. Could I ask if we've got a seconder?
Seconded, Chair.
Okay, thank you. That takes us nicely on to the next item then, which is agenda item 3. Members to declare any interests in matters to be discussed at the meeting. Could I ask if members have any interests to declare? Okay, I'm taking silence as no. And can I also check whether any members have any political party whips to declare? I can confirm that there's no political whip on the meeting, so we can move on. Agenda item 4, additional items of business. And can I ask whether any members do have any additional items that they wish to be considered as a matter of urgency? I haven't received any prior to the meeting. No. Okay. Agenda item 5 then, which is the first substantive item on the agenda tonight, which is enquiries submitted to the council, but specifically those relating to the board's terms of reference. Can I ask officers to present this item?
If I may, Chair, just start the intro to this. I said the report itself sets out the information in relation to member, MP and general public inquiries, and Nikki Denson's going to take us through some slides which will outline the current position with inquiries and obviously give more information on the current position, and obviously open up for questions as well.
Okay, thank you, Alan. Good evening all. As I said, we are actually going to go through a presentation on general inquiries tonight. I have put that on the screen. Can everybody see that?
Yeah, it'd be helpful if you could just put it on the PowerPoint view, you know, the little television screen at the bottom, just to make it a bit bigger.
Okay, is that better?
That's fine, yeah.
Brilliant, thank you. So I thought it was worth giving you a bit of background really around general inquiries that are coming into the council at the moment. So my team has the customer service centre. So we deal with 500,000 calls per year, and that's been a general trend over the past few years. We're currently dealing with around 8,500 calls per week. And the calls that the contact centre actually deal with are really generic from obviously from the scrutiny here, repairs, housing, but we also deal with children's, regulatory services, highways, trees, pretty much everything apart from adults and revs and bends inquiries. So everything comes through the customer service centre. Currently, of the 8,500 calls per week, 50% of those are currently repairs. At the moment, we are taking essential orders only as part of that. But obviously, within that, there will be people that will be calling up asking about their repair that they may have previously reported, or they want to report a repair that we are currently doing. And Steve will go more into that in the next agenda item. Roughly 25% are housing related queries, and then everything else, as I've mentioned, equates to the other 25%. The advisors are all generic, so we haven't got any specific skill sets. We use specific skill sets if there's an actual situation where there's a flood of volume of calls, but generally we operate a generic system where all our advisors are trained on all the areas that we could take calls for. This means that at the moment they're using 7 different IT systems. So the advisors need to have obviously that IT knowledge. They've got a lot of knowledge around lots of different areas across the council. In respect of housing and repairs, we use 2 systems. Housing, which is, they use the Open Housing IT system. This is an integrated system that covers lots of different areas, including choice-based lettings, rents, tenancy management and estate management. And for repairs we use Advance, and again Steve will touch a little bit more on that, but we use that particular system for booking repairs and obviously chasing any progress on that. The actual telephony system that we use, Inform 360, that uses a menu approach. This menu approach directs and prioritises calls. So when people come through to the number, they're asked to press 1 or 2 depending on the actual call that they want to discuss, and that will actually prioritise the calls within the queue. So for instance, children's calls, because this could actually be a priority safeguarding issue, will automatically get prioritised within that queue of calls that are coming in. We are performing really well at the moment. We call it an AR, which is our sum of all the abandoned calls and the time waited and the calls that we actually take. Our target is 10%. We are performing at the moment in the region of 3.5 to 4%. Mondays is our massively general time for calls coming through, but even this week we were less than 3% for taking those calls. Our ambition generally within the contact centre is to deal with everything at first point of contact. So we push for the advisors to have the skill sets to be able to deal with queries and not necessarily have to push those queries through to anywhere else. That isn't always the case that we can do that. It depends on the type of query that we're getting through. Obviously the more simple inquiries, things like booking a repair, a missed bin, something like that, we want to deal with at first point of contact, and we actually do that, and got high levels of being able to resolve things at the first point of contact. If there are things that are more complex, it could be something around homelessness or rents, we may have to pass that call on to a different service area. Just in terms of the call handling process and how we do things, as I mentioned, the call comes through the menu and gets directed to an advisor. Our call waiting times can vary per day and during the day. We use a scheduling system that looks at the volumes of calls coming in every day and throughout that day, and we try to ensure that we've got the volume of staff appropriate to those times. So we've done a piece of work recently around the call waiting times on a Monday morning. A couple of months ago, at its longest, people could have been waiting for 18 minutes on a Monday morning. We rescheduled the way that we reprofiled our resources rather, so that we've got more people working first thing on a Monday morning, and the longest waiting time currently is 10 minutes. So, that's quite a significant drop in the longest waiting time. Most times people are waiting 2 to 3 minutes on a Monday morning. We do try and get over to people as well that, everybody tries to ring through between 9 and 10 on a Monday morning. If they did ring through, 11, 12 o'clock later in the day, the wait is significantly less as well. But we appreciate that people may have had issues over the weekend and want to get in contact with somebody. As I mentioned, the advisors will attempt to resolve the query whilst on the call, and that does tend to be the more simple transactions. If it cannot be dealt with by an advisor or is more complex, then we do sometimes have to direct that to the respective service area, or in some instances, an individual case officer who is dealing with a specific issue for a tenant. From a system perspective, for the customer service centre, when we do that, the initial inquiry is dealt with. And if I sort of move on to response rates, we've broken this down into 3 categories. So we've got the total number of councillor inquiries, and this is January to January, so January 2019 to January 20. We have 2,029 councillor inquiries in total. We do have a really good response in terms of councillor inquiries. We resolved 97% of those within the first 10 days, and then it went after that to 0.5 within 11 to 15, 0.5 between 16 to 20, and 2% of those were dealt with 21 days and above. In terms of MP inquiries, our response rate is lower. We had 261 MP inquiries, and those were dealt with, the ones that were dealt with within 0 to 10 days equated to 58%. So you can see the difference between the councillor inquiries and the MP inquiries. And some of those MP inquiries did take longer. So 32% of those are taking over 21 days. But that is something that the customer feedback team are looking at the moment to understand the reasons why that is.
Sorry, Nick, I always prefer to take questions at the end, but over what time period is that in terms of response rates? Is that the last 12 months? Or? It's
the last 12 months, yeah. So it's January 2019 to January 20. January 21, sorry. January 20 to January 21.
Right.
Yeah. So it's, yeah. Sorry. So the total number of public inquiries, we had over 140,000 public inquiries. From a customer service point of view, and I'll explain a little bit more about that in the next couple of slides, we've dealt with 98% of those within 0 to 10 days. So from a customer service point of view, like I've said, we try and resolve as much at first point of contact, and when we pass anything over to a different service area, then from the customer service point of view, then the issue is resolved. So in terms of council and MP inquiries specifically, council inquiries did increase by 13.7%, and MP inquiries, it should be 2020 and 2021, I apologise. MP inquiries increased by 16.8%. Really the potential reasons for that, obviously the pandemic, some of the services have been restricted or changed. So, in terms of the service of repairs, as an example that Steve will talk about, Obviously that service has been restricted in the way that it can operate, so that generates then additional inquiries. Customer access points are not operating in the same way. So obviously at the moment, with the one-stop shop being closed, the Samuel Local being closed as well, people are having to interact with us in a different way, and that can generate additional inquiries. The biggest increases in councillor and MP inquiries have been around repairs, housing allocations and rents. Most of that has been sort of chasing progress on already scheduled repairs. Housing allocations is a high one for customer feedback anyway, and tends to be where people want to understand how they access the choice-based letting system. And also rents as well, and a lot of that has been about making arrangements to pay and things like that. So we've had, as I mentioned, the response rates on council inquiries and MPs inquiries. For us, we think that the reason for the differences in responses is that we tend to find that council inquiries tend to provide us with more information. So we get more information to start off with, and don't necessarily need to go back to the councillor to get any more information. We can look at that inquiry. Councillors tend to understand the local context and operation of services better. So again, it helps us to have that information to hand. And also we've got the opportunity more so to discuss the cases with councillors if we need to, where that doesn't tend to happen with MPs inquiries. We get a lot less information up front. And it means that we then have to do more contact to the resident or to the MP to be able to get that information. So general inquiries generally, housing related queries sort of pre-pandemic were collated both via the contact centre and walk-ins from the Samuel Locals. But obviously as the Samuel Locals are closed at the moment, all the contacts are currently coming through the contact centre. We're receiving around 2,500 housing related queries per week. This has remained steady really. Initially in the first lockdown we had more queries coming through, but it has steadied off, and we think that really is because customers are using online services more, and their behaviours are changing and they're doing more for themselves online. And as part of the contact centre operation, we do send through, for some service areas, links as well for people to do the work themselves. So from the contact centre point of view, as I've mentioned, we'll identify the resolution when the advisor has done what they can to resolve the issue. This might mean that we need to pass that on to a different service area. The way that we do that is we pass something called the comms on. And that's part of the open housing system, and we will pass that through to one of the service areas, and to the officer specifically if it's a case management issue, asking them to get in contact with the tenant, and obviously to speak to that tenant around their issue. So in terms of future plans for us, we're always looking to improve the service and look how we can make the customer experience better. We have a service redesign project group that's been set up. That's with officers from Neighbourhoods and the contact centre, and that's initially looking at all tenancy management inquiries. That could be anything from a change of circumstances, a succession, an assignment, mutual exchange, anything like that. And what the redesign project group were doing was to actually look at the whole of the process end to end and see whether they could redesign that to streamline it, with the intent of making that digital, so that it would be easier for tenants to access the information themselves and get the queries resolved themselves. Currently, that's happened in 34 accessible online services. Some of those, including things like rent balances, have just gone live. It's surprising how many queries we get from tenants just asking what their current rent balance is, which is something we got as a contact centre we can deal with relatively simply. But while putting it online, it means that actually tenants can do that themselves, and obviously that avoids a contact coming through to the contact centre. We've also set up a working group that's currently working on avoidable contacts. So this is looking at across particular housing management at the type of contacts that should be dealt with at first point of contact. So what we're looking at is things that are repeat contacts, things that are coming into the contact centre that actually could be dealt with online or dealt with in a different way. Things, you know, it could be that we're putting comms on to officers. If they don't get back to the tenant in a timely fashion, they'll come back through to the contact centre. So what we're trying to do is work with housing management as a service area to look at these types of things to make sure that we reduce the amount that actually we shouldn't be getting through the contact centre in the first place. We're also, as part of the Housing Ombudsman Code of Practice, we've undertaken a review of our existing processes, particularly on customer feedback. That has highlighted our compliance in that particular area, and that is a positive. And there's an action plan that sits underneath that that we'll be working on over the next 6 to 12 months. So that's the end of my presentation. I'm happy to take any questions.
Okay, thank you, Nikki. Perhaps just ask Alan Caddick if there's anything he wants to add as the director before we open it out for comments and questions from members of the committee.
Yes, I will just say something, Chair. I think the key thing for me is always trying to review what we're doing and how we can improve things. I think what we will always have to have, though, is provision for those people who haven't got access to laptops or the internet or whatever. Or those who are elderly, vulnerable and the like. So whilst we're always reviewing and always trying to get people to do things online because that's easier all round and people are getting more used to that, we've still got to be able to provide for those who need some assistance. And I think it's getting that balance right and making sure that no one gets left behind as such.
Okay, we'll open it out to comments and questions from members of the committee then. Can I ask if anybody has a question they wish to raise? Councillor Ahmed Boston.
Thank you very much, Chair, and thank you to Nikki and Alan for that very useful presentation. Just two quick questions from me, if I may. In light of the coronavirus pandemic, are contact centre operatives working from home? And if so, have we had to introduce any additional measures in order to ensure data protection compliance? And secondly, Nikki mentioned that once an inquiry is passed to another department within the council, it's closed from a contact centre perspective. But do we have any data that tracks what happens to those inquiries? Then how long does it take for them to be dealt with? Because obviously from the resident perspective, it's not resolved until it's resolved. So information regarding that would be useful. Thank you, Chair.
Okay, could I invite either Nikki or Alan to respond?
Yeah, I'll take those if that's okay, Alan. Sorry. The first one in terms of home working, 95% of staff currently are working from home. We've got a small team based at Railway Lane that are currently working as a very small contact centre. There's roughly 8 people that we have working here. The reason for that is when the first lockdown happened and there was a rush to get everybody working from home, the solution that was deployed by IT, which was called Raspberry Pi, I'm not sure if anybody's familiar with that, and it was very much let's get a temporary solution in place and obviously get everybody working from home. From a contact centre point of view, working from home is something that we've always wanted to do, and we haven't necessarily had the technology to be able to do that. The Raspberry Pi solution has allowed us to do that and to send, like I say, I think we've got 8 out of 52 people working at Railway Lane. The reason why we've kept a small amount is literally because if that system fails, because it's not a fully functioning home working solution for a contact centre, we actually take things like children safeguarding calls, and that could prove to be a major issue. So it's really a backup plan for us that if there are any issues with the IT system working from home, we've got a backup. We're currently starting a project on telephony across the council with the contact centres being the sort of priority for new telephony. And it will be that working from home, the whole of the contact centre will be one of those things that we want to do. Home working for us in the contact centre has been a major success. Performance has improved dramatically. Our sickness levels have reduced dramatically. People are enjoying working from home. In terms of your quote about GDPR, that's all been risk assessed as part of us of having people from home. They're using the same systems, the same laptops and equipment that they used within the contact centre. Like I say, we have a risk assessment that covers the GDPR element to ensure, obviously, that data is protected. So, that will be something that we'll be taking forward in terms of the new telephony project, so that 100% of the contact centre staff, once we've got a fully functioning proper contact centre home working solution, we won't have any staff situated in any office accommodation. And the second question regarding tracking queries once they've left the contact centre, yes, we do. We do track the performance of that. So we do have to then fully close down any inquiry once it's been dealt with, and we do keep the time limits, the actual response times in a similar way to those I presented earlier. So we have got that information, and obviously if the board would like that information going forward, that is something that we can provide to you.
Okay, thank you, Nikki. Councillor John Edwards.
Thanks, Chair. Yeah, the figures were interesting, weren't they? I think the total number of complaints in the year given, was it 142,000, I think, calls came into the centre.
I'd say inquiries, I wouldn't assume complaints, but...
Sorry?
I'd call them inquiries, I wouldn't assume they're all complaints.
No, but I guess not many of them are compliments either, Chair. I bet many people don't phone up to say that everything's hunky-dory. So I think, and it's good to see that from the evidence that Nikki presented, that those calls are dealt with in a appropriate and timely fashion, and most people do get a response to their query, stroke complaint, within a reasonable time, and that's good. But I guess what is less good is that maybe 50% of the population of Sandwell are using the call centre for one reason or another. And I'm just wondering on the bigger picture, and maybe it's one for Alan, what is really valuable data, how it's used, how it's processed to enable the council in developing its services and improving its services, to take account of areas of concern, why people ring the call centre in the first place, given, as I say, that not many people will be ringing to compliment us, I'm sure. So I'm just wondering how we use that data to improve and drive the improvement of services in those areas revealed by the call centre calls to be in need of improvements one way or the other.
Can I just maybe start and then Nikki can come in with some of the detail? Yeah, I think one of the things that Nikki referred to is the fact that we are doing, sorry, someone just give me a drink. We're doing reviews of how we're doing things, and that is informed, or those reviews are informed by what we're living and breathing every day. So we're always looking at learning from what's coming in and how we can actually improve the service delivery. So to give you some reassurance, we are using that information to good effect to try and change things. So, the whole thing around rent balances that Nikki mentioned before, if people can just go online and look at their rent balance, there's no need for us to come into the contact centre. So just that as a point of learning is something we've done. Now, what that also does is saves us costs in postage as well, because we will post out quarterly rent balances, we'll post out rent letters and whatever. Now, if we can do more of that online, it saves the council a significant amount of money in terms of postage costs, which, as you can imagine, for the number of things we send out, is a significant cost to the council. So that's just one example of how we use the learning from what's coming into us to do things differently. Does that help?
It does, Chair. Yeah, thanks, Alan. So I assume that the information that's flowing through the contact centre, where it reveals areas where some improvement maybe is possible and necessary, do each of the council's area of service receive that information and be able to digest it, incorporate it into plans and so on and so forth?
Nikki, do you want to come in there?
Yeah, I'll come in there, yeah. The contact centre have got, each of the supervisors within the contact centre has got an area that they are responsible for, and we have meetings with those areas on a regular basis. So areas like Serco, we have meetings with repairs, meetings with housing management, all the different, we get meetings with children's. So we discuss those numbers, we discuss any root causes that are coming out. Data is really important in terms of management of the contact centre, to be able to understand what's coming in, but also anecdotal information as well from the advisors themselves about the types of queries that they're getting through, any frustrations that residents are having, any issues that the advisors themselves have in terms of trying to progress queries and trying to get those resolved. So those sort of meetings really help to, in partnership, to be able to resolve issues. And they've been, particularly important around things like Serco with the bins over the pandemic. We're then right at the forefront of having that information directly, so we can respond to things quickly. So that's sort of really important. The data information from the contact centre I get on a daily basis, down to an advisor level. We've got a lot of data that sits there. We understand the types of calls that are coming through to the contact centre. And as I've mentioned, we're doing a lot of work with sort of slicing and dicing that data to understand the types of contacts that are coming through, the types of contacts that we should be able to deal with at first point of contact. If we're not, then that might be a training issue for the team. And we've got a training plan in place. We've also had, over the last 12 months, a customer service and training officer who specifically, her role is to ensure the staff are trained on current issues, because obviously as processes change, they need to make sure that their knowledge is up to date. She will also look at all the data and identify if there's particular areas where there's issues, and we might need to have contact with service areas. So it's very much a data-rich area, to be honest, and it is something that we use on a daily basis to try and improve the services. As well, it's a real fast-paced environment. As I mentioned, we get 500,000 calls per year. So it's not necessarily always there that we're sort of understanding everything that's going on. It is literally that we need to deal with things, but we are now taking the time now we're performing, and that was one of the issues. I think when I took over probably 2.5 years ago, we weren't performing very well at all, and the focus was just trying to answer as many calls as possible. We're in a much better position at the moment, which means that we've got time and resources to be able to understand those calls and to make better decisions around them.
Okay, Alan Caddick, please.
To add to that, one of the things that all this does is informs our performance reports. So all that data's churned, and it really does help us with our performance reports that we pull together against a range of different things. So there's a science to what we're doing to give you some reassurance that we do take heed of the data that's coming through. We do review it, we do learn, and we do inform our performance. And if we need to revise our performance indicators, we can do that accordingly. But that'll be based on data that we're getting in and how we're using that data.
Okay, I've got a few comments and queries, but I'll ask whether any of the members have any questions or comments they wish to raise first. No, in which case I'm going to leap in with a few. The there was reference in the presentation and in some of the remarks around the digitisation of services. I'm particularly keen to know where we're at with getting some of the council housing services and other services that fall under the remit of this board onto the My Sandwell portal for members of the public to use. It would obviously significantly reduce, I imagine, the amount of physical contacts that are actually coming through the contact centre the quicker we can get that online. Alan, I think you're on mute if you're trying to respond.
No, I was just saying, have you got any more, Councillor Moore? So if you can give us any, we'll probably.
Sorry, yeah, a couple of other areas I'd just like to probe as well. I mean, I think it's picked up slightly by Councillor Boston. I mean, although the overall sort of response rate looks quite impressive, I mean, my own experience of certain aspects of some services that fall under the remit of this board is that actually response rates don't seem to adhere to those. So I'm kind of keen to press a bit further about whether all cancer inquiries are actually being logged as cancer inquiries by officers, and really what we're classing as a response. I mean, somebody acknowledging an email, for example, is very different from having a substantive reply and a resolution to the matter. And I think my third query really is just around reopening of neighbourhood offices. I mean, obviously I understand that's not possible at the moment due to COVID, but again, some reassurance, and I think we've touched on it at previous committee meetings, that you know, the council is not looking to move away from having neighbourhood offices for members of the public to visit those in future when hopefully COVID restrictions permit those offices to be open.
Shall I do that last one and then?
I was going to say, do you want me to pick the first one up about the digitisation?
Okay.
So as I mentioned, in respect of housing particularly, we've looked at over 70, nearly 80 processes under specifically tenancy management within My Sandwell. There are areas there that we need to do more of, in terms of making that more interactive, the back office system. One of the major areas that will have a significant difference on the contact centre, and your point, Councillor Moore, about reducing the number of contacts coming through, is repairs. Over the last 12 months, a huge amount of work has been done between the customer service centre and repairs and the digital transformation team on developing online repairs. This is probably going to be the first one that's sort of a real interactive solution from end to end. So it will be that a resident can go on, tenant can go on, book and actually physically book an appointment slot. It will take them through the diagnostic tool that the contact centre use to actually identify where the repair is and give a bit more information. This reduces obviously the need for any form of pre-inspection. They'll be able to choose the booking slot that fits them, and that's something that we're looking to go live in the spring. We're just in the process of testing that at the moment. So we've tested it within the contact centre just before Christmas, and that went well. But as I mentioned, 50% of calls that come through the contact centre are repairs. So you're looking at 250,000 contacts per year, calls per year coming through. We need to make sure that this system does work end to end. That will have a dramatic impact on the volume coming through the contact centre. But what we also need to ensure is that it's right. Tenants, the thing that they ring us up the most about is repairs. If we don't get that right and they get a bad experience, then that might put them off using other online services, and that's what we don't want. So that one will have a huge impact. In the background, the other 40 so areas for digitisation on housing are things that we're progressing in the background, and we're working closely with the digital transformation team on those. The pandemic has had an impact on the delivery of those, purely because some of those resources have been directed into things like the booking system for the lateral flow testing. and things like that. But there is a plan. Nigel Clumble, the service manager for housing management, has got a plan to get those processes online. You know, and housing is a major factor in the contact centre, so that will definitely have make a difference.
So we're looking towards the spring on that, Nikki. Are those services going to be integrated onto My Sandwell though? Are people going to be able to log on to their customer account and they're going to see all of the housing services on there as well as everything else?
Yes, that's the intention. So they'll be able to look at a mutual exchange or a garage or a range of different things, and like I say, be able to report a repair, cancel an appointment, rearrange their appointment. There's lots of possibilities. The things that we're putting on My Sandwell from a housing perspective and a repairs perspective have got more functionality than existing things on My Sandwell. We wanted to make sure that, that these things are, we didn't want that manual intervention. We wanted to make sure that if we do something, the customer's got, the whole control over that particular system. So when they go on, they can report the repair, book their appointment. If they can't attend it, they can reschedule appointments, that sort of thing, without having to contact the contact centre at all. Some of the My Sandwell functions now in other service areas, there still is a need for some manual intervention. We decided from a housing perspective we didn't want to do that as much as we possibly could. So there's things like choice-based lettings, the application form, again, being able to sort of go live with that. At the moment, you need to print it off, scan it, and provide your documents. That process we look to change completely and to make it more functional so that all of that can be done online. So although it's taken longer, we've learned the lessons from the initial services put on My Sandwell and trying to make them more functional for tenants.
So good news coming in the spring. Steve Greenhouse, I think you've got something to add.
Yeah, Councillor, just to add what Nikki was saying, the reason at this moment the repairs is not on the portal is because we've got a big upgrade on our back office system, and that needs to go in first before we can go online with that. Otherwise, the tenants will have a poor experience, like Nikki was saying. Once that's in, that will improve the experience, and also it's on there. The actual booking the appointments is for the non-urgents, because if it's an urgent emergency one, we want them to phone the call centre so we can attend straight away on there.
Okay, and sort of on the second 2 points, as I said, Alan, kind of building on Councillor Boston's query really around response rates and kind of quality of responses. And I'm not going to pick out specific bits of the council, but there are some areas in my view that are not particularly responsive to inquiries. So I don't necessarily recognise some of the figures that were in the presentation. So maybe just a bit of comment about that, and then also around the neighbourhood officers. It seems we're very good, as I said, it actually handling the queries in the first place. It's the actual quality of the responses. I just wanted to dig down a little bit with that question. You're on mute.
When we talk about end to end, I think that is the whole thing. It's about when the inquiry comes in, it's then how we go right through it to make sure that it is dealt with. Because if we don't deal with it, it just comes back again and again and again, and that just creates a lot of frustration, a lot of anger, and a lot of dismay. So we've got to get that better. And I think when we do talk about end to end in terms of our processes, that whole thing around response rates is important in the first instance, because we're acknowledging the inquiry, we're saying yes, we've got that. But then if we don't deal with it, or if we're tardy in dealing with it, it creates another inquiry as to why is it taking so long or whatever. So I do think the end to end and the communication with yourselves as members and with tenants per se has got to improve, and it's got to get better, because that's important going forward. And now we've got a lot more access to online services, a lot more access to communication tools. We should be able to do that more readily. So I do think that's something that we've got to do. You asked about whether all council inquiries are logged. Now, I would say yes, they should be. We can look at, if there are issues and any things you've got as examples, we can deal with that. But you know, yes, all inquiries should be logged and they should be then dealt with accordingly. So I do think that tracking and that closure of them is really important. So it's something we can do more on, and maybe bring something back to a future meeting, which maybe sort of digs down a bit deeper, as you say, in terms of some of this. In terms of the neighbourhood offices, again, I think as has been said already, if we're doing more and more online, if we're doing more and more where people can self-support, etc., then that should mean that there's fewer people coming into our offices. So COVID will teach us a lot of things in terms of how we operate, and I do think that I can't see us going back to how the neighbourhood office operated before COVID. I think we've got to learn from that and look at how we then operate and put a new operating model in place. And that's something we're going to have to discuss with yourselves as members, because obviously that's going to be quite vital at a local level. So I do think that review of what we've learned from COVID and some of the things we've had to do quickly. I think what COVID has done as well is it's accelerated a lot of things that probably would have taken in a normal world years. We've brought things forward at pace to actually enable us to be more light on our feet to deal with issues, and that then puts in sharp focus how our offices will operate going forward. And so I don't think they'll operate, and no, they won't operate as they have done pre-COVID, but we do need to think about what the role of those offices are going forward and working with yourselves on that, and also with tenants as well.
Okay, can I ask whether any of the members have any questions or points that they wish to raise, or different views from what we've heard already? I'm taking silence as no. Can I just thank everybody formally on behalf of the board? Sorry, Councillor Boston.
Thank you very much, Chair. Sorry, I was just slow in finding my hand up button. I just wanted a clarification from one of my earlier points. Are we talking about the contact centre moving to remote working permanently post-COVID, or was Nikki referring just to while we're in this COVID pandemic? I just wanted clarification on that. Thank you.
Nikki, would you like to respond?
Yeah, no worries. Like I said, there's a piece of work that's going on at the moment, which is a whole telephony review across the council, with a real focus on contact centres. So we've got 3 contact centres in the council. There's the generic contact centre that I'm responsible for, one for Eggs and Bens and one for adults. So we're looking generally across the piece about what telephony technology we need. We are, there is a need to update our technology. Generally, we are quite far behind in terms of what's available out there, and that's something that excites us because it gives us the opportunity to use different tools, things, integrating with social media, things like that. But also, in terms of home working, I think it is something, like I said, because it's been embraced by the staff, and it has had some positive impacts on performance and sickness. It will be something that we intend to look at going forward, definitely, in terms of making the contact centre more remote than it is currently. We got forced to do it by COVID, and in some respects, I think as managers we're glad that it did, because it actually allowed us to see whether it was possible to manage staff and to manage a contact centre environment remotely. And it has, and it's been successful as a result. So I suppose the answer shortly really to your question is yes, that is something that we will be looking into.
Okay, thank you very much. I'd just like to place on record really the board's thanks to yourself, Nikki, and all of the teams within Neighbourhoods and the wider council in terms of the efforts in responding to people during the pandemic. It's certainly not easy. And like to put our thanks on record for all of the work that staff are doing. In terms of recommendations, I'm not particularly hearing a kind of a chorus or a sense of anything we want to recommend on this particular item. What I would like to see though is a further report back in around 6 months' time around the digitisation of services that fall under the remit of this board. That's not simply just around housing services, but around some of the other services such as green spaces, parks, etc., leisure services that also come under the remit of the board. and I think that would be quite helpful. Councillor Boston.
Yeah, thank you, Chair. Might I also recommend to the board that we consider recommending getting more information and more data, really, just further to your point and my point, on the journey of an inquiry once it's passed to a department. I think we've got a good sense of what happens when inquiries are dealt with within the contact centre and resolved then, but I'd be very interested in knowing about inquiries that go on to other departments. How long does it take for them to conclude? Are they concluded in a satisfactory way? If so, which percentages are we looking at? I think we really do need data on that, because that will help us best inform how well we're doing as a council in terms of serving our residents and our constituents. Thank you, Chair.
I'm happy to second that as well. So, I mean, I think what we're asking for, not specific recommendations, but 2 further reports back in the future on those items. Can I just check, Alan, whether that's feasible? If we maybe set a target for sort of 6 months' time.
Yeah, it's eminently feasible. That we'll do whatever we need to do, really. And I think we could bring you some really good examples of how things do well, and maybe some where we maybe could have done better.
And as I said, on the digitisation, if we just make that a broader thing than just housing,
yeah, okay.
Everything else that comes under the remit of the board.
Okay.
Okay. I don't think we need to take a vote on that, Alex, do we?
If no members wish to, mark any dissent against those, I think we can take them as approved.
Okay. Very good. In which case, we're moving on to the next agenda item, which is number 6, the housing repairs update. I'll just kind of caveat a little bit around the purpose of bringing the report to the board, first of all. Obviously, there have been various restrictions, national restrictions in terms of what is and what isn't possible. At times, that's meant the council, particularly around repairs, and at certain times being able to go into properties and not being able to go into the properties. So the purpose of today really was to just get a little bit of a better understanding of where we are with housing repairs in terms of the pandemic, whether there are outstanding repairs or a backlog, if you want to call it that, or a waiting list, how the council might intend to deal with that when restrictions do ease, and really just a little bit further information. So I'm pleased to say we've got the head of repairs, Steve Greenhouse, who is always very responsive to inquiries, I have to say as well. So, Steve, it's over to you.
Thank you, Councillor. Nikki's putting the documents up for me because she's in the same office as myself. Like.
2 metres away.
Yeah, we are 2 metres. We are. Yeah, just a bit of background, and as you say, you're all aware that obviously the issue that we've had with the COVID and the impact that it's had on the repair service. Just regarding to health and safety with the COVID-19, I mean, risk assessments have been undertaken to ensure the safety of employees and tenants. And over the years since when we went into lockdown in March 23rd last year, we review the risk assessments regular, and we're actually on version 14 at this moment and ensuring. And just why with the risk assessment, we've just completed a video for tenants that will go with the text messaging. And it's about the safety of themselves and the safety of employees, telling them what they need to do before we come in to do a repair, etc., and how we'll carry out that repair and ensure that everyone's safe with the cleaning, etc. I will forward that on as well, to everybody that they can look at this video. It's also on our intranet there and also on YouTube, and it's just gone out actually tomorrow morning. It starts, so it's really relevant. Just on the number of repairs, even though we've been, we've had a lockdown. If we take repairs, and when I say repairs, we talk about gas servicing, electrical servicing, etc. Since the pandemic, we've still carried out 132,000 visits, which is really significant with the lockdown that we've encountered. During the first lockdown in March, we only undertook the internal essential repairs because obviously nobody knew how this pandemic was panning out. So everybody had the lockdown, and you know, we had people working just doing the essentials. But what we did do, because we had voids maintenance, empty properties, we actually didn't stop carrying out the work on there, but obviously did the risk assessments to ensure that our employees were safe in working on there. So the voids actually carried on as there was no issues. Since the lockdown, we opened back up and we started to do some of the non-urgent orders on hold, and then we went into tier 3 in September, and again we had to stop doing some of the internals. So what we've done since then was delivered the internal essential repairs, carried on with the voids, but we also picked up external works on this that was on hold. So we've been carrying out the external works since July, August. So that's where we are at this moment in time. Just what the repair definitions are, so to make everyone aware. Internal essential repairs, they're jobs deemed to be health and safety within the property, which includes annual gas servicing, our 5-year electrical safety checks, excuse me, and also works that's classed as court case if a solicitor's got involved with tenants. It comes through our private sector team and court officers, and we actually carry out work as it's essential. External repairs, that's any routine repair, that's whether it's non-urgent, whether it's urgent. We've been carrying out those works like fencing repairs, slabbing, etc. As I say, void repairs, we haven't stopped doing those. So if any works that's got to be done to an empty property, we've been carrying out that, obviously at social distance and that. And other repairs that we are doing internally, in some plastering orders that are on hold, that would be deemed to be like health and safety, where there's large areas of plaster that's come off the wall or the ceilings have got holes in. We're carrying out that work as well internally. Moving to the impact on this on the service, current orders on hold. The last count last week, we had 1,000 orders where tenants previously had ordered this work to be done, and that was classed as non-urgent routine repairs. From this, we got 230 plastering orders. Obviously, some of those are being done as we speak. And then the non-urgent general orders, we got 850 of those, which is such as repair to kitchen, like kitchen unit doors, but they're safe. They're not, you know, essential to do. Renewal of some floorboards, again, they're safe, but they just need renewing. Renewal of internal doors. When it says gas and plumbing, that's a little bit misleading. The gas and plumbing, basically, it could be a radiator that's gone rusting, which says that it will be renewed, but it's still working. But that's what the type of work that's been put on hold on there. And electrical repairs, that's installations where we might need to install an extra socket for somebody, but it's not dangerous, that can wait. And also, it might want a fan renewing, but it isn't an health and safety issue to the tenant. Further impact on the service. Excuse me. Just the annual gas servicing rates. When we went into the first lockdown in March, come May, our gas servicing had dropped to less than 97%, 96.73. But Mohammed, who works in is our admin manager on the gas servicing, he's been working with the tenants, and our actually rate at the moment is 99.56, which is incredible. And the reason why it's not higher than that, it's not us getting into the properties. We've got a lot of engineers, and also the contractors have actually isolating at this moment, so it's resources. But 99.56 is a really high. That gives us, out of 23,000 properties, there's 115 that we haven't serviced in the 12 months. But you know, we're doing everything we can to get into those, and hopefully over the next couple of months that percentage will even go up even higher. Void relet times. Last year we outturned at 24.15 days. At the moment we're running at 29.27 days. But if I take the actual repair work, we've actually taken an extra 0.2 days more than we did last year. The reason why the extra 5 days is because come the first pandemic, it was decided that we'd only let essential lets. So there was a lot of properties that was completed on works but had to be let afterwards. That's the extra 5 days. But everyone's doing everything they can to get that down to even further from the 29.27 days that we're doing. So that's credited again to the housing management and to my team as well. And like it says, we've done 132,000 repairs or visits to properties since March, since the last pandemic. And also looking at it, if we do a full year, it will probably end up about 158 to 160,000 orders. Normally in a year, we normally do around 170,000. So if we say the impact on the service, obviously because tenants aren't phoning in to do some non-urgents, we've got non-urgents on hold. So it's had an effect between 10 and 12,000 repair orders, the impact over the year. And hopefully it won't be more than much longer than a year that we can get back to normal. Just looking at on these orders that are on hold, we had, when we was coming at just before Christmas, our rates of COVID had dropped to around 80 odd per 100,000, and we was just after Christmas we was going to start doing all the non-urgents, and then during Christmas it shot up to 1,020 per 100,000, and at the last minute in the beginning of the week of January we had to resort back to what I've just gone through. So. And I've had that conversation with managers who work in repair service, and what we intend to do once we can get back to normality and start doing some of the non-urgents, we'll be working with our contractors who do pick up some of our works like plastering and some of the non-urgents, and we'll be trying to get those done as quickly as possible to get us back on track once we've gone back to where we can do all routine repairs. And also we'll start then also doing the non-urgent inspections as well to internal properties. Just like talking about complaints and you know, to follow on from there, we obviously with, like Nikki says, that their team works with ours, and that's correct. We have a quality officer who works in each town, and we have 6 of those. So any inquiries, complaints come in, and they deal with those, and they're still going out now to deal with tenants every day. And we deal with our complaints, we average of 6 days to complete our complaints that we get from and also councillors' inquiries, etc. Some may take a little bit longer because obviously we need to do more information, but on average complaints we complete in 6 days. And talking about complaints, I have a finance and performance meeting every month, and complaints is always discussed, and we tend to, our common complaint is that it's delay in service. But when we look at our performance, we're actually carrying out, when we've done all repairs last year, all our repairs was carried out in an average of 8 days. So we do delve into why people are putting delay in service, and we do fail at some times, and we am trying to improve that on there. So we ain't saying, oh, we do everything great, you know, we do make mistakes. But we also look at the number of jobs we do to the number of complaints, and it comes out at 0.20 complaints to the number of orders that we do in any 12 months. We're not just also looking at complaints, we also look at our customer satisfaction, and at December, our customer satisfaction, all the customer satisfaction is done by text message, and all the stuff comes in through text message. And we got a target of 89.5%, and our satisfaction is cumulative, is running at this moment at 94.4%. So that is a really good rate that we've got. As I say, I think on there, that's about all I've got to say, and I'm open to any questions that anybody wants to ask me on that one. If I don't think I've missed anything.
Okay, thank you, Steve. That's a very good overview. And you know, although I do have repair queries, it's seldom that I have to come to yourself, and when I do, they're resolved very promptly. So I don't think the report's suggesting there's a kind of a wider problem with the service. It was in terms of getting an overview with COVID and where we're at. Alan Caddick, if you'd like to come in, please.
Thank you, Chair. I just wanted to take this opportunity to thank Steve, really. Steve has done some commendable work over the past 12 months, I've got to say, in terms of trying to keep things moving, and obviously the staff keep them involved as well. And again, I think that goes under the radar a bit, and without Steve, I think we'd have had a worse situation, to be honest, because he's put a lot of effort in the last 12 months, which I'm personally very, very appreciative of. He does a lot that goes unnoticed, so I want to go on record about that. I think the other thing as well that we've tried to do as well, Steve made reference to the risk assessments, and we're on version 14. So we've constantly, weekly, reviewed the risk assessment and see if it's fit for purpose. But what that also involves is a lot of work with the unions, and we've done significant work with the unions over the past, the pandemic period. Regular meetings, regular calls, and we've actually worked with them, and constructively, I've got to say. So I think, this is about us all coming together and trying to actually deliver a service despite the real issues we've got, and also the concerns of staff. And we have had lots of concerns from staff about going into properties, and that's very difficult because, we've got tenants who expect a service, but they also see the COVID bit. But we've got government guidance saying that repairs should be done regardless, so we've got that to consider. And, we tried to find a way through this minefield in the last sort of 10 months. And I think we've done really well, considering, to be honest. And again, a lot of that is down to Steve. And again, I'm very appreciative of his work in this regard.
I can see Steve blushing with all of the praise from you and I, but yeah, it's well deserved.
Councillor, can I just also say, because I do look after all the improvement works as well, which, it was housing repairs rather than improvements. Obviously, the internal improvements had to go on hold, and it still will be on hold, but we are still carrying on with all the external improvements as well. It's at a slower pace. We are behind on our programme, but it is still going ahead. What we intend to do is I'm working with our procurement officer and working with our accountant, is that we'll be looking at the future programmes and trying to bring them back in for when we do future programmes, and put the budgets where we haven't spent, if there is an underspend, put them on to actually draw some of it to bring it back on programme. And when we do get back, there is some kitchen, I think there's a number of kitchen refurbishments we've got to do, and tenants are being kept updated of all the information with when we'll start. We was hoping to start sometime in January, but then we've had this further lockdown and we've had to put it back, so it'll probably be the spring when we carry on with the further refurbishments internally. But just saying that though, I mean, something on there, we have been working on a block in Applewood Grove, which is for the homeless properties as well. There's 20 odd properties in there, and hopefully the end of March that will be ready for the lettings team and the homeless team to start working with them, rather than putting people in hotels. They'll have a nice flat type apartment to go into while they're waiting for permanent accommodation.
Okay, I'm going to open it out for comments, questions from members. If you've got a question, could you please indicate or type in the chat bar. Councillor Boston.
Thank you very much, Chair, and I'll echo what Alan said earlier. It's hugely impressive to see the excellent work that Steve and his team are doing. 94.5% satisfaction is huge, and credit to him and his team. I just had two quick questions, actually. The first is in relation to, obviously, the new variant has led to a higher transmission rate. So what work are we doing with or is Steve's department doing with public health to ensure that we can protect staff that are still going in for essential repairs as much as possible? And do we have a system in place where our vulnerable residents are prioritised for essential repairs? Thank you.
Yeah, just the first question is that all our employees, if they want to now, can have an LFT test. That's a lateral flow test at West Bromwich. So they've been given those opportunities to have those. We're also working on, obviously it all depends with the NHS, and we are working with public health, and I have prioritised our employees who go into properties into two groups, which is over 50s and vulnerable, if they've got any pre-medical conditions, if they're not shielding, if they haven't got those letters. And if it comes where we are classed as key workers for the vaccine, then those, if this vaccine is available, then they will be prioritised to have a vaccine to help those out. Then you talk about vulnerable tenants. If a repair is emergency, we'll treat everyone exactly. We'll go in straight away anyway. We go in within 24 hours or 2 hours, depending what they are. And yes, if they say they're vulnerable, we're meeting the targets of what we need to meet. So I haven't had a problem where we've got a vulnerable tenant that we haven't been able to meet their needs. So it's probably a difficult one, that, because I wouldn't, if I've got emergency to do, because if I look at, I mean, there's a large number of our tenants, I'm over the age of 65, and we've got their, if water was coming through the ceiling for anybody, we'd be there within 20 minutes, you know, as soon as we can. We've got a 24/7 out of hours service as well that we attend to.
Okay, Alan, did you have something to add?
Yeah, just to just add to what Steve said. One of the things we've done from day one is work very closely with public health. So all our risk assessments have to go through public health, have to go through the unions as well. They have to be signed off. So we've done that on an iterative basis to, again, keep up with, you know, the changes that have been made. Every time there's a guidance change, we have to change. So we do work very closely with public health. The fact that we've got staff going down the lateral flow test route, again, was to give reassurance to staff that there was something available for them. And also with tenants, you know, we're very clear that if tenants are feeling vulnerable, then we will work accordingly around that. But also, in terms of staff, if staff go into a property and they feel it's not right, they have, you know, they're empowered to come away from that property, and, you know, the repair won't be done. So we've been very clear to manage risk and work with public health around that. So just to give that reassurance.
Yeah, just sorry, Councillor, just the final one on that one. We have had a number of tenants who have actually got COVID and it's an absolute emergency repair, and we tog up, we are, you know, in the full PPE, and we actually carry out that repair, you know, so we won't stop not to go in a repair if it's that emergency and we need to go in that day, we will do that.
Okay, Councillor John Edwards.
Thanks, Paul. Thanks to Steve for that. It was really helpful, a really helpful presentation, and I agree with Councillor Boston. There's some great work being done in very difficult times, so thank you for that. I didn't quite catch the full detail of the point you mentioned towards the end of your second contribution, that I think was quite important actually. It was, I think you were talking about homelessness and a new way of approaching how we deal with that. Could you just run through that again and maybe elaborate on that a bit more? Because I think it is something we've talked about at this committee before, to seek a better solution to that issue. Could you just outline in a bit more detail on what the plans are around that?
Yeah,
do you want me to give an overview first, and then you come in about Applewood per se?
Yeah, do you want to do the overview? Yeah.
Thanks,
Sorry,
Alan.
Chair, for
Okay, Alan, if you want to come in first, and then we'll from Steve second.
I thought you might ask a question, Councillor Edwards, about that, to be honest. So I was primed for it. But one of the things we have done over the pandemic period is done a significant amount of work around homelessness. So, for instance, you know, our rough sleepers, we've really tried to work with them to accommodate them. Our use of temporary accommodation is the lowest it's been for many, many years. And our use of bed and breakfast is the lowest it's been for many, many years. So we've worked very proactively over the past 10 months to really work with our homeless families and the homeless people. So as well as we've got the visible homeless who you might see on the street, we've also got those people who you don't see, who have got issues and are homeless by virtue of their circumstances. So we've got that. But what we've always wanted to have was an option that meant we had control of a particular set of properties, which meant we could then refer people into them rather than to temporary accommodation, which will reduce costs massively in terms of where we are. but also give a better accommodation option for those people in the interim whilst we're waiting to get them into more permanent accommodation. And what I would say, just to put some quantum on it, we've probably reduced our costs and temporary accommodation in the last 10 months by around £800,000, and that's because we've been very proactive around things. And when we bring Applewood Grove in, which Steve can talk about in a minute, that will give us even more opportunity to have good accommodation for people and also reduce cost. So that just gives you the context of where we're at the moment, and Steve can say something about Applewood.
Yeah, Councillor. Applewood Grove, it used to be a council block of flats many years ago. Then they refurbished it, and then it was for small businesses. Well, about a couple of years ago, or 18 months ago, the small businesses started to move out, and they asked us if we wanted the building to use it. And then Wendy Pennicott, who works for the allocations manager, she says, is it possible to refurbish it for homeless? You know, if we've got any homeless cases, rather than being put into hotels, it would reduce the costs as well. So under our improvement programme, we've taken it, and there's quite a lot of work that's had to go in there, but it's a lovely building. I mean, obviously people can go and have a look at it once it's all complete. It's got an atrium where it's got a glass roof in the foyer and that, and there's 20, I think there's 25, 26 properties altogether, and there's also on the ground floor room for disabled tenants as well. So that will help that. And there's a couple of flats as well where if they've got a family, there's an interlocking door where that can use 2 flats for one family, so people ain't are in separate rooms. So like Alan says, they've reduced costs by about 800,000. This will reduce costs even further because you can £100 a night. It can cost to put someone into an hotel where you're talking of like weekly rents on properties about £90. So this will reduce it, and also it will be a far superior place for people to be, in a flat in these properties and being in a hotel room. Yeah.
Steve, can I ask a very brief? Oh, sorry, John. Did you want to come back in?
Just quickly, Chair, if I may. Just what's the capacity, Alan, of the new location?
Oh, you mean Applewood Grove?
Yeah.
Yeah, there's about 25 properties in there.
Okay. I think this is really great news, Chair. It's almost a shame it's come as an anecdote to the meeting, because we probably need to know more about this in due course. I mean, I'm particularly impressed that one advantage flowing from this clearly will be the ability, the more ease of ability for other agencies, health, benefits, all of the other people who need to step in to actually support people if they're in one place. Logistically, that's a lot easier than people falling through the net. So it sounds to me like a really brilliant move, and thanks Alan and Steve for making it happen. It would be good to know more about it in due course, Chair, but many congratulations.
I think Alan's probably going to say that's what they're hoping to do, that all the services come together, because I'm going to have a reception area down there where the housing team are actually based down there as well. So Alan, I think that's probably what I was going to say.
Yeah, if I may, Chair, just come in if that's okay.
Yeah, if you want.
Yeah, I was going to say that, but again, we're quite happy to come back to this meeting at a later date with any information on our homelessness approach, and again, where we are with temporary accommodation in the round. So some really positive news and some excellent work by the staff. Yeah. And again, I think that goes unnoticed sometimes, the work we do behind the scenes, and again, bringing some of that into focus, like tonight, for instance, is really important.
Yeah. Chair, just a final one on Applewood. It would have been in operation, but what we found out with the atrium, because of all the fire regs and that, we had to have a smoking ventilation. But when we went to do the alterations on it, then it produced building regs. So we've had to end up putting a new roof on it, and that's delayed it for about 8 to 9 weeks. So hopefully by the end of March, that should be in progress then. And obviously Alan said he'll bring more stuff back.
Okay, lovely. A very brief question, just in terms of the works orders that are outstanding. And
yes,
I mean, I to be honest, expected the number to be higher. To be honest, so the fact it is only around the 1,000 mark, I think it was in the the presentation is commendable, but what will you do in terms of actually revisiting those tenants? I'm conscious that some of the tenants may well have actually undertaken the repair themselves. Perhaps that's somebody else to come in the time that they've been waiting. So what will you do to actually go back through those?
Well, what we do, we've got a list of every repair on there. And we was in July, we was putting them back into appointments, but then we had the further lockdown in September, went into tier 3. We've got them all on a spreadsheet, the type of works. We've kept the tenants informed, and then what we'll do again, just when we know we're out of lockdown, we'll be phoning the tenants again to say we've got this job. Someone as probably says, like you've says, oh, I've already done that now, and you know, and then obviously we'll put that on the system that is completed by the tenant. And what we'll also, as I say, is to try and get a fresh, when we start the inspections and we've got new work coming through, is trying to get this older work done by part of our team and also by our contractors. So we're running adjacent with the old and the new as well. So we don't get a build up of new work taking months. So and to get back to our repair times that we've got set out.
Okay, thank you. Can I ask if there are any other questions, comments or different points of view from what we've heard already from members of the committee? Okay, I didn't think we had any recommendations particularly coming out of the conversation. Councillor Edwards, I think there was a request perhaps for a further report around Applewood Grove, which we heard referenced. Is that something you wish to put forward?
Yeah, I think that would be really helpful, Chair, at the appropriate time. But maybe a visit would be good as well. I'd be really interested to see the facility.
Okay, well, if we work that into our future work programme as a future report, whether a visit's possible, who knows? We can
subject to, Chair.
Yeah. As I say, the building should be operational by the end of March. Because at the moment we've got scaffolds straight through the middle of the block, waiting for this roof to be renewed.
Okay, well we'll note that in terms of a further report and a potential visit if restrictions do allow. In terms of the meeting, that concludes the substantive business for this evening. Our next meeting is on the 25th of February at 5:45. Again, that will be a virtual meeting online. Can I just thank everybody again for attending this evening? We've already noted the excellent work of Nikki and Steve's teams, but we'll place it on the record again. Thank you, good evening, and stay safe.
Thank you very much.
Thank you, Paul.
Thank you. Bye.